Thank you very much. It's a pleasure to be here. So we'd like to start by telling you a little bit about the North Shore-LIJ health system. It's an organization which has always promoted an environment of lifelong learning. To that end, over 12 years ago, the Center for Learning and Innovation was created. It is the corporate university for the North Shore-LIJ health system. And the reason that it was created was, like many other organizations across the United States, was to always ensure that our organization had the ability to meet our patients, our employees, and the ever-changing healthcare environment needs. The corporate university started with a couple of classes. It was meant for leaders in the organization, and obviously, if you look at this slide, it has grown immensely over the course of time. In 2012, we had over 43,000 student encounters. We are an organization of about 60,000 employees, and we've had over 158,000 learning hours. We started, as I had said, with our organizational development piece and have really grown over time to meet the organization's ever-changing needs. So we currently have a Patient Safety Institute where we employ simulation and work on clinical and teamwork skills. We have a scholar pipeline where we're trying to help to develop the youth in our communities and get them engaged in ongoing healthcare education, as well as get them interested in working, hopefully, in any one of our healthcare environments. We have an Emergency Medical Institute, which trains EMTs and paramedics to help bring our community into our hospitals and help make sure that there's a high level of care. We also have a medical school, which we are very proud to say is currently 3 years old, and helping to grow the future physicians. We have a Bioskills Education Center, which is a tissue center which physicians are able to practice or utilize in order to develop their skills instead of on you and me as test subjects on live tissue. And we have a clinical transformation unit which actually works with our teams. You heard earlier individuals talking about lean and working on performance improvement. What we're really here today to talk to you about is one of the segments of the Center for Learning and Innovation, our Physician Leadership Institute. So approximately 18 months ago, physicians in our organization actually came to us and said that they would like to create an educational session for our medical directors. It's approximately 18 individuals, and they were hoping that we would be able to create a session because they recognized that some of our medical directors were having difficulty meeting the needs of our changing leadership landscape. And so we did create a 6-course session for them. And almost as you can imagine, after the first 2 sessions, some of our medical directors came to us and said, "This is great. How do we get this for our team members? They need education too." And I took that as a good sign. Why? Because if they like and they're willing, like the old Breck commercial, to tell 2 friends who will tell 2 friends and so on, that's a great thing for us. And so our Physician Leadership Institute was really formed, or really formalized. We have different components of our Physician Leadership Institute. We start with every month we have Physician Beginnings, which is where physicians coming into our organization actually come and understand what our mission, vision, and values are. We have about 40 physicians or 35 physicians attending each month. We offer leadership development, and that's really what we're going to focus on today in our talk. We have department-specific education, where we actually work on leadership skills or visioning sessions with each of our departments. We have team-building sessions, where we work with them, and of course, the clinical education that happens in teams from our Patient Safety Institute. So how did we really get to where we are today? Well, if you notice here, there's 2 different measurement systems. The old school ruler was really leadership of yesterday, getting to figure out how physicians and the leadership of the organization work together. It was an old way of measuring and letting us work together, usually in silos. So they weren't necessarily measured in the very same way. But in today's fashion, we have a very different measurement system, very high tech. And so we really need to be able to look at our environment to figure out how does leadership, both on the clinical and the non-clinical side, get measured. And so I'd like to turn it over to Dr. Smith.
Thanks, Patti. So I thought what I would do is give you the color commentary to this program, since Patti is really the person responsible for pulling it off. But realistically, we're a big health system, 16 hospitals, 9,000 physicians, of which about 2,600 are employed, and an equal number of nurses. We are the dominant caregiver in the New York metropolitan area. And yet there was not a day went by in my work life where someone didn't bemoan, how is it possible that being smart enough to go to medical school made you so inept at being a leader? You know, and so we would have long discussions on, did we unteach any shred of leadership in medical school? Did we select people who would only wanted to be solo players? And of course, what happens is that the fact of the matter is that while administrative people practice leadership from the day they begin their formal studies every day of their life, young physicians try out and practice their clinical skills and perfect them for many years without really much cognizance of being a leader. And so they are the fighter pilots of our generation. They have strong telling skills. They like command and control. They like to be the chief guy in the room. They're very self-confident because no one dares cross them. And so if you look at some of the characteristics that we're looking for in physician leaders, we need to select for and transform these very bright, well-meaning people who are successful in other realms of activity, but the skill sets that make them successful clinicians, successful researchers, successful clinician scientists, master educators, deans of medical schools, may not be the same skill set that makes you capable of being an influential leader. And so either we have to select differently for the people or begin to bring them along early in their careers. And I just show you this list of some of the characteristics of good physician leaders so you'll understand. Some of the lessons we learned very early on. So what Patti didn't tell you is we have a high potentials program that preceded physician high potentials, because I guess it was assumed that either physicians had it or they didn't, and they were unlikely to learn anything. But I slipped 2 physicians into one of the classes. I don't remember whether I identified them as physicians, but I knew that they were good candidates, and they came back saying this was really good, but a lot of the stuff wasn't relevant, and if you wanted to streamline the program for physicians, you probably had to dedicate a chunk of that program to just physicians. That sounded good. So the next year, we had a physicians-only physician leadership high potentials program, and I think we learned some real lessons there. So I'll give you my take before Patti gives you the actual results of our program. People who have been promoted to leadership because they were good at something else other than leading, who completely fail, don't do well in a high potentials program. You don't fix those people in any way, shape, or form. Now, there may be ways to fix them, but it isn't enrolling them in this type of a program. And they have a negative overall impact on the group. People who have never awakened happy in their life are very poor candidates for this type of a program. You laugh, but there are a lot of those people. And so you need to be very careful that this is really about development of people still in a phase where they see themselves as developing, and not remediation for someone who has failed in a role that they probably should have never been promoted to. The other thing is that the people you put into these programs need not to be uniquely creative. They don't need to be already unbelievably successful, but they must at least approach this with a sense of flexibility and a willingness to try new things, and to understand that maybe what got them to where they are isn't the same as what will get them to the next step if what they really want is to truly be a leader. And of course, if I had to say one thing, if you're interviewing people for this program, and the question they ask you is, so when I'm promoted, who will report to me? that's the wrong person to put in the program. Because again, they're seeking the endless command and control as opposed to influencing people to follow them. So we did a needs assessment of the whole group that you heard about, and it wouldn't surprise you the things that they said that they really wanted to learn more about. Budget management, change management, conflict resolution. They were usually the source of the conflict, so it was good for them to want to learn how to resolve it. Finance, which they uniquely seem to be oblivious to, especially when requesting resources. Strategic planning. Delegation, which I think is a very big deal when you've been trained from day one that the buck stops with you. It often is hard to learn how to actually trust people, delegate appropriately, understand who and what you can delegate to, and the capacity of the people who are part of your team. And you see down fundraising, which is an interesting thing, strategic planning, which they're often part of but usually don't feel comfortable in it. And so, as Patti said, we have physicians beginnings, the new physicians who join our health system. And that's mostly a cultural orientation to the health system, what we believe in, how we function, the scope of the health system. The Physician High Potential program, which we're talking about, and we're going to go in great detail about what is included in the 2-year program and some of the metrics we have. Our medical directors, who are the first ones to come and say, we were not prepared for this job, could you help us? Those are the physicians who in single hospitals would be the CMO of the hospital. They're the medical directors of each of our individual hospitals. Many of the departments came to CLI to ask for specific training for leaders, for second-tier leaders, for specific programs to be solved where leadership had really failed. And of course, we tried to get people early, so we said if we can do this with medical directors and department chairs and division heads, why not go after the chief residents earlier in their career and see if we can influence them there. So the Physician High Potential program, which is rolling along right now, and I think ever improving and quite successful. Patti's going to show you the details of what we take the physicians through, but I think more interestingly, a little bit of the data.
Great, thank you. So the first thing that I want to say is the educational platform for all of these programs is really experiential and interactive. We really try very hard not to lecture at our students. We want them to be engaged and to want to develop as opposed to feeling like they have to develop. So our Physician High Potential program is mimicked really after our High Potential program and is a coordination between medicine, HR, and the Center for Learning and Innovation. And this is 1 year of the 2-year program, and you can see it has quite a few facets to it. First is every physician who comes in performs assessments, EQ, 360 assessment, as well as the Myers-Briggs, and this year we actually added the Thomas Kilmann instrument, which is a conflict resolution instrument. Individuals undergo executive coaching, not as a punishment or saying that they're not able to do something, but actually as a way of helping them to develop their executive skills. They have both individual and group sessions, and you can see that they attend several classes at the Center for Learning in the way of identifying and addressing the needs that were identified through our needs assessment. They also have just as much of a packed second year where they go through level 2 courses. They still have coaching assessments. They attend executive forums where they get the opportunity to meet and understand the challenges and the roles of our executives across the organization. But at the end of the 2-year program, we actually have the opportunity to re-implement the emotional intelligence assessment. We really want to be able to see, has everything that we've done helped their leadership skills in any way? Well, why did we choose the emotional intelligence assessment? Well, I'll tell you why. It's because really across the continuum, emotional intelligence, or the ability to interact with individuals around you, and the way in which you perform and develop relationships is really one of the key leadership skills. So we have our assessment results from the first class, and you can see in blue, those were the pre-assessment. They were averaging probably about a 72 across the board on emotional intelligence. Most of the research that's been done out there actually says that a key leader, an organizational leader, should have an average score of an 85 or above. So our physician leaders, or our high potentials, were below expectations initially. But you can see at the end of the program, actually, their average score was above about an 85. So we had significant growth over a 2-year program. And actually what we've recognized in addition is that for the most part, our first class and our second class of physicians actually mimic one another. So we're looking forward to the end of the second year where we'll be able to have some additional studies. The circles actually represent statistically significant difference between year 1 and year 2. And so you can see all 4 components of emotional intelligence actually improved, more than just by say-so. We also conducted a study or a satisfaction survey with our physicians at the end of the first class after the end of the 2 years. And you can see that the satisfaction from our physicians from having participated in the program is extremely high. Now, they are picked, so we understand that hopefully it should be high, but when it comes to being able to say that I've gained new skills, that I would recommend the program, I'm better prepared for a leadership position, that it helped me grow and be ready to gain new scope and responsibility, to be able to have a 95 to 100% agreement, strongly agree in those categories shows that the program is moving and meeting its objectives. So we asked the physicians to overall rate the program, and several of our physicians actually have attended MBAs and other programs throughout the United States, and they overwhelmingly, 92.3% feel that they agree that the program is very satisfying to their development. So that says a lot for our instructors and our leaders for putting an investment into our physician high potential program. And so as we get ready to open the floor for questions, we figured we would lead you with a slide. And I don't know if in the back of the room you can see what it says, but when we talk about leadership, sometimes it's smooth sailing, sometimes it gets rough and stormy, and sometimes you sink to the bottom with your crew. That's why it's called leadership. And so we really feel that overall the Physician Leadership Institute is really going to be helping our organization not sink to the bottom, but actually be able to rise to the top. So we'd like to open the floor for questions for either Dr. Smith or myself. Yes? How many physicians apply and do not get in? That information actually varies year to year, but probably the first year we took 55 physicians out of, Cynthia, do you remember, was it 80 or 90? 85 physicians, so roughly a third, did not get in. The second year we recognized that to wield a class of 55 and be able to give them each individual attention certainly was a lot, and so for the second class we took 32 physicians, and sorry Cynthia, do you know what the original application was for the second year? How many physicians applied for the second class? How many? About 100. So the programs that we're offering through the Physician Leadership Institute are starting to grab hold, much like our regular high potential program. So more people are coming forward requesting, and therefore it's just going to be harder and harder to actually get into the program, more selective.
I'm just curious, in some of the development opportunities, are maybe the physicians blended with other non-clinical or other clinical providers of those mixed?
Yes. Yes, thank you very much for asking that question. In several of our programs, we actually have the opportunity to mix both our physicians and I'm going to call non-physician components. In the team buildings that we do, it's physician, it could be nursing, it could be their clerical staff. On our Patient Safety Institute side, it's intact teams, so it could be the ICU or a floor of OBGYN that comes through, and that includes everybody. Our Physician High Potential program also has the administrative high potential program, and actually in December we are offering a case-based class where we're actually going to work through a Harvard business case and have the opportunity to have both administrative, nursing, and physician high potentials work together. So yes, there are several opportunities. Yes.
Sure. So the question is, have we done a good job with young physicians mentoring them to be leaders in the future? And the answer, I think, is almost certainly no. I look to some age-old things that I've always gone by. One is that it's very hard to believe a physician will ever develop to be better than where they trained, because that's your formative stage, and if you happen to unfortunately train in the midst of mediocrity, you will think that's terrific, and that's what you'll aspire to the rest of your life. And so one of the things, and one of the reasons we've segregated the physicians from many activities in the leadership group is we expose them continuously during those 2 years to physician leaders. And oftentimes they haven't met really good physician leaders. And even the chairs that they may have worked under in their residencies or their fellowship leaders may have been put there for other reasons and not been particularly good leaders. But the other thing that's really critical is that when they're finished, they need not just mentors and role models, but they need someone who sponsors them. If you finish this program and no one ever recommends that you get put on a key committee, a key task force, you get considered for a promotion, if no one's there pushing your name forward and the same old crew just keeps showing up at all the committees in your health system, then you've wasted your time, because we've done all this work for these young people, and without older people with gray hair saying this person now should be sitting on this committee, this person should be running that task force, this person would be great to lead the critical care standardization team or something like that. And I think we forget that that's sponsoring them to get out of their usual work routine and into positions where they can really grow is critical.
The one thing that I want to also add from an educational perspective and the times is in 2013, 2014, the demands that are placed on physician leaders are probably very different than they were 15, 20 years ago. So I don't want to say that perhaps we didn't really have to pay as much attention in the yesteryear, and that's part of the ruler and of how we're being judged. And I think in the scope of transparency and what we've been talking about is we really do need the partnership between our administrative leadership and our physician leadership in order to be able to meet those goals. So I think we have an extra layer where we really now have to invest in our physician leaders and partner. Thank you.